Officials are outlining what the next stage now in the coronavirus vaccine rollout will look like. But for now, what many states say they need are more vials of the vaccine. KCTV5's Nathan Vickers spoke with health officials on both sides of the state line.
Nationwide, nearly 6 million Americans have received their first dose of the COVID-19 vaccine. But it's been a slower process than many had hoped for. Despite this, Dr. Lee Norman, director of the Kansas Department of Health, says the state is gaining ground.
We haven't gotten the total amount of vaccine that the feds have promised us, but that which we've gotten, we've pushed out essentially immediately, and it's been going into people's arms, and that's what the goal is.
Local health departments are preparing too.
We are ready.
We reached out to officials on both sides of the state line. Jackson, Wyandotte, and Johnson counties are all preparing to escalate the vaccination effort once they receive more product.
We ourselves are starting to do some prioritizing here for folks who we would consider to be most at risk.
Here's our promise. We are going to be giving out those vaccines as we receive them.
It's so exciting to have the vaccine here. It is the light at the end of the tunnel and a sign that we're returning to normalcy.
In Kansas, around 30,000 people have received their first dose of the vaccine, around 1% of the state's population. In Missouri, 105,000 people have taken it, around 1.7% of the state's population.
This, for all intents and purposes, is an immensely successful and safe vaccine.
Norman says Kansas is also catching up on reporting data to the CDC, and that most places in the state are already preparing for mass injection sites.
On balance, we're hitting on all cylinders, but we really need more vaccine.
In Kansas City, Nathan Vickers, KCTV 5 News.